I say digital health is not about technology, it's about the human experience. Technology is the enabler here to provide an improved user experience and a more seamless user experience and more empowered and insightful user experience. And I believe that this summarizes the work both as a physician, as you said, as a corporate executive, later on as an entrepreneur.
Welcome to 20-Minute Leaders. Just sit back, relax, and learn from the leaders of today. It's a journey. Each one is different, unique, inspiring. Let's get started. This episode is powered by Qure Ventures, a community-driven VC fund in Silicon Valley, in partnership with Lomitech, and sponsored by Homeward Ventures, Hippo Insurance, Upwest, Hillel at Stanford, Leap, and Birthright Excel. Welcome to another episode of 20-Minute Leaders. Today we're going to be speaking to Dr. Yossi Bahagon, founder and active chairman of Sweetch. An internationally recognized leader in the field of digital health, Dr. Yossi Bahagon is an active family physician who founded and managed the digital health division at Clalit Health Services, the second largest health maintenance organization in the world. Following the acquisition of his first digital health company, Yossi founded Qure Ventures, Israel's first digital health fund. In 2013, after witnessing the impact of patient non-engagement on the individual and nationwide levels, Yossi co-founded Sweetch. Today, Yossi serves as the company's active chairman. Dr. Yossi Bahagon, how are you today? Welcome.
I'm good, thank you. Good morning, and hi, Michael, and thank you for this attention and time.
Of course. Thank you very, very much for joining me from Jerusalem. Dr. Bahagon, you have such an incredible wealth of experience in the digital health space, especially here in Israel. You've had quite, a wide range of experiences, from being an executive in corporate to leading digital health initiatives that are impacting now millions, to then entrepreneur through an acquisition and in investment roles in digital health space with Qure. And now being chairman of Sweetch and watching this entrepreneurial journey from another side. And I'm excited to sort of peel your journey and towards understanding your greater vision and why you do what you do and the insights you have into the digital health space. And so this is going to be a really fun conversation. And I want you to take me back a little bit and perhaps even begin by sharing with me what sort of your grand, mission in this world is, or in your professional life. And then how did the various experiences that you've experienced, how did they lead to you being able to enact on this vision?
Sure. Thank you, Michael, for this great question. If I want to summarize my work along the last 20 years in the digital health space, before it was called digital health, I would say that it's about patient centricity and patient empowerment, or in more professional words, sometimes it's called participatory health, meaning how do you create solutions that truly puts the patient, the person, the individual at the center? How do you empower someone to be a better partner in managing his or her own healthcare? And I think all the things that I've done, and you've mentioned some, as a physician, the ability to not only to integrate the information that you know and you learned, but also to feel when a patient needs a hand when he or she comes into your clinic, and simply hold his or her hand. Going back to the very basic values of being a physician, through the privilege I had in founding and building the digital health division of Clalit Health Services. Clalit Health Services is the largest health organization in Israel, and actually the second largest health organization in the world after Kaiser in the States. So going there through a journey.
Wow.
Yeah. So going there through a journey that, takes the organization from an organization that was based on pen and paper. And I don't know if the audience know, but today in Israel, 100% of the population have access to their personal health record. You can access all your lab results and imaging results and medications and hypersensitivities, and everything is accessible through the smartphone and through the web. And not only that you can see your data, you can also act upon it in various ways, whether from ordering your chronic prescriptions without any paper, having telemedicine sessions. I'm speaking 10 years before COVID. So in 2000, and to speak today about telemedicine, it's like, became a commodity. But in 2010,
a trivial thing, yes.
I said telemedicine and people asked me, tele who? So, tens of thousands of interactions monthly that are taking place today in this, and all the data is obviously analyzed at the background. So, and many times, people ask me what digital health is all about, and it goes back to the definition that I just shared with you. And I say digital health is not about technology, it's about the human experience. Technology is the enabler here to provide an improved user experience and a more seamless user experience and more empowered and insightful user experience. And I believe that this summarizes the work both as a physician, as you said, as a corporate executive, later on as an entrepreneur. And these days, as an investor and board member in various companies, and specifically Sweetch, where I serve as the chairman, because this company, that's what it's all about. It's about personalizing proactive healthcare in the preventative space. So to prevent diseases before they even happen on large scale.
Can you take me back 10 years before COVID? This is a topic that is fascinating to me. You're in a corporate, you're saying that the second largest healthcare provider, in the world after Kaiser, and you are put in charge to figure out tele what, tele who. What does this mean to now digitalize, our health records and allow us as patients to take sort of ownership and be partners with you on our endeavor to become healthier and live longer and happier lives? What is that like, leading this initiative? What is sort of the vision of this e-health idea of, 10 years before COVID, when people weren't speaking this language? What challenges are you posed with as you're going through this endeavor?
So you are very right with the way that you phrase your question, because it wasn't clear back then. What does it mean to put the patient in the center? It's nice words, but healthcare is a very traditional industry that is operating in a certain way for hundreds of years. There is very clear hierarchy. There is the physician, there is the patient, there is the medical team, there is the hospital. It's very, very clear and very defined, who does what. And essentially, technology here, and when I say empowering the patient and providing tools for the patient to be a better partner in his or her own managing own healthcare, it needs a change in the roles. Because once you make the patient more insightful, more responsible for his or her decision making and the ability to make this decision, it creates a shift in the traditional roles of medical teams and physicians. And part of the figuring this out was to indeed understand, how do you make such a shift without creating damages? Like taking the good things that are existing today in the system and improving them, rather than, doing an evolution rather than doing a revolution, which,
Right.
Can be a significant hurdle in a traditional industry. More practically, what we did, back then, again, we didn't have a reference to look at, because we were the reference. The digital health services that my team and I built at Clalit became in many aspects a global benchmark for nationwide deployment of digital health solutions, similar to what we see today with, that Israel is a living lab for COVID. 10 years,
Yes.
I'm saying it in the good sense. 10 years ago, we were the living lab for digital health because the system here is built for, relatively quick deployments of technology in relatively large populations. So we started from looking at what was done in the banking and finance industry, where digitalization started about 10 years before the digitalization started in the healthcare industry.
Wow.
And we understood how they did their journey to put their customers at the center and to streamline the processes. Obviously, finance and medicine are very, very different. I will give you maybe one example. It's easy to say, yes, I will present you your data in your smartphone. It was the really, really early days of the smartphone, not even. But presenting your data technology-wise, it's easy. But doing it in an ethical way, so imagine, it's very obvious for you to see your data, but what if you have a 16-year-old daughter and you are responsible for her. You are supposed to see all her medical data. Is that simple? What about if she goes now to the physician and wants to get contraceptives? Still, you will see her data? And what if she now thinks, oh, my father will see my medical data, so I will waive on getting contraceptives? And then you find yourself with a bigger problem. So which data to present, which data not to present, to whom to present it? This is not a technological question. This is an ethical question that requires a lot of consideration. You can't present a patient a negative lab test, meaning something that requires holding his or her hand through a smartphone. Oh, you are HIV positive, or your cancer result came back positive. So all these things require a lot of thinking in the interface between technology, ethics, understanding humans' behavior, psychology. And I think this is what is fascinating about digital health, that it brings all these things together in the most important things in our life, which is our health.
I think that, you're opening up such an important and an interesting conversation because, traditionally, as we're talking about, as I'm thinking about digitalization more from a naive mindset, I'm thinking, great. It's simply the process of taking all this paperwork and all these appointments I had to make, and now I'm putting them online in a nice app. But you're presenting this whole new dimension that we have to consider, where we're actually talking about people's lives here. We're talking about explainability issues. We're talking about psychology, a lot of philosophical questions about, how do we present this information and how do we do it ethically and responsibly? So as a leader of these initiatives and having, been the leader of this great initiative, which sounds like, led the benchmark and led the way for the world to understand how it's done. How do you personally cope with a lot of these challenges? How do you put together, this thesis of this is how we're going to do it. This is the right way to approach this problem?
Well, first, I don't have all the answers, and that's part of that's part of the building it up. Different people, different motivations, different things that lead them in life, and the ability to serve these people is a lot about listening and listening and listening. When it comes to healthcare, it's not just about getting the right answer. It's also emotional, and it also goes to your values and a lot of things that you need to combine when providing, a technology solution. Maybe I will use this question to give the Sweetch example. Sweetch is targeting improving disease management and preventing chronic diseases. From the very beginning, we understood that for such a solution to work on the long run, it needs to be highly personalized, like personalization like never done before. Because we all know that it's very important to walk 30 minutes a day or to reduce or to lose weight and so on, or to take your medications on time. But in practical, most of the people, or a large proportion of the people, don't do it. About 45% of the people don't comply with their recommendations to do what they need to do. So what Sweetch, with this in mind, what Sweetch built is a solution that focuses on the providing the right recommendation at the right time, at the right place, in the right context, with the right tone of voice. So instead of telling you, hey, Michael, it's very important for you to walk 10,000 steps a day, the type of messages that you will get is, hey, Michael, you have 45 minutes before your next meeting. It's raining outside, so maybe take an umbrella and go to pick up a Americano from the nearest Starbucks. It's only 9 minutes away. Once again, the idea is to touch you in a highly personalized way, in a very contextual way, in order to push you to trigger action so you will do what you need to do, and then to learn through what you actually did or did not do, which messages influences you the most. So if I'm going back to what we started from, this is an amazing example for participatory health, for empowering a patient to be a true partner in managing his or her own healthcare. It's about proactiveness, it's about personalization, and it's about prevention. Combining all the values that we spoke about earlier in this interview.
I think that is so fascinating, and I love how we've transitioned the conversation from simply this idea of transparency and explainability to now this contextualized personalization for action-oriented participation, right? This idea that now where the goal here is, by putting the patient in the center, this actually means empowering them to become partners in what used to be a more passive process of doctor-patient, and I think this is. It's exciting to me to think that this is where we're heading, and it's inspiring to me that these are the sorts of things that you're involved with, which goes back to our conversation right before starting to record this episode, talking about this cliche type idea, but not really. This idea that really, making, leaving the world a better place and doing it through, these different endeavors and improving people's lives, which I think is fascinating. And so, Dr. Yossi Bahagon, I want to go back a little bit and understand you a little bit better. Share with me, what really fascinated you growing up? Did you always know that you're going to be a doctor and a physician, and you're going to be in this intersection of technology and health, or were you curious about other things?
So actually, you pointed out without even us speaking about it before. Yes, I from the time I remember myself, I wanted to be a physician. The complexity of the human body and, the interface between the physics and spiritual and psychology, and this amazing, I don't want to call it a machine, because I think it's by far more than a machine. The more we learn, the more we know how complex it is. And the ability to touch it in a way that is meaningful, values-wise, or the way that you described it now, to influence people's life in a meaningful way. So that was like a chord from the time, I remember, what I wanted to do as a grown-up. And this was a lot influenced. You asked about my childhood, so this was a lot influenced by, my grandmother, my grandfather both came from the crashes of the Holocaust and built their life through being persistent and creative, and I believe this is something that, if you would ask my children what influenced my life, they would tell grandmother. So, and it goes back to the combination between values and creativeness that we spoke during the last 20 minutes.
Right. I love it. And if you had to choose a few words that would describe yourself, looking at your either personal or professional journey, what kind of words come to mind?
Persistence. I'm sure that when you interviewed the entrepreneurs in the past, this word came over and over again because it's a roller coaster by definition, and you need to be a person that doesn't get a no as an answer and still do it in a sensitive way. Thinking out of the box, meaning being able to connect dots when it upfront looks like they're not connected. So finding creative solutions to complicated questions or issues. And being resilient. Maybe it goes back to the persistent thing, but I think it reflects a different angle. It's a tough journey, and resilience is part of it. That's why it's not suitable for everyone, but it's a fascinating journey, and being in a place that can truly influence millions and tens of millions and more lives. It's really, I see it as a privilege.
I love it. Dr. Bahagon, thank you so much for joining me. This was wonderful. Continue making a positive impact on so many people, and stay safe and stay healthy. Thank you.
Thank you, Michael. Appreciate very much the questions and the insightful interview.